The first week after birth is critical for puppies' survival. Good care and keeping visitors to a minimum help protect them. The mother is also recovering from birth and may have afterpains. Warmth, their mother's milk, and a clean environment are essential for the survival of newborn puppies. But how do you get all of this right? Keeping newborn puppies warm is especially important because canine herpes virus multiplies more efficiently when a puppy's body temperature is low. Puppies can become infected with canine herpes virus before birth, during delivery, or shortly after birth through contact with their mother's infected secretions. They are at the great risk of fatal disease, especially when they are very young. During the first 3 to 4 days, it's good to keep the puppy's environment at around 32 degrees Celsius, 90 degrees Fahrenheit. Then I lower it gradually to 29 degrees Celsius, 84 degrees Fahrenheit, by day 6 and 27 degrees Celsius, 81 degrees Fahrenheit, by day 9. Keeping the whelping area warm can be stressful for the mother. It's important to make sure that both she and the puppies can move to a cooler area within the nest when needed. Puppies can also get hot. If they are lying separately, spread out on their sides instead of huddling together, they may be feeling hot. When checking the temperature, place the thermometer close to the whelping box and the puppies. This gives you a more accurate reading of the temperature the puppies are actually experiencing. If a puppy's body temperature drops too low, it can develop hypothermia. A puppy also needs to be warm enough to properly digest and absorb nutrients from its food. A puppy that feels cold should be warmed very carefully and slowly. Puppies should receive their mother's colostrum as soon as possible after birth and continue nursing about every 2 to 3 hours. Once they have learned to find the teat, they will usually nurse on their own. However, it is good to help the puppies to give them the best possible start in life. Puppies absorb colostral antibodies through their intestines mainly during the first 24 hours after birth, so it is very important that they all get colostrum regularly. Even after this, puppies often still need some help finding a teat. The mother's milk is the best possible nutrition for the puppies. It provides everything they need for healthy growth and also contains important immune factors that continue to support them as they grow. Don't start bottle feeding too easily. Even with a large litter, milk production usually increases with demand. The more the puppies nurse, the more milk the mother produces. The mother's appetite usually starts to increase within a couple of days after giving birth. Until then, offer her foods she really enjoys. Soon, the mother will be happy to eat many meals a day. She needs plenty of high-quality protein and fat, as well as adequate carbohydrates, to support her own health and milk production. However, avoid making sudden changes to her diet, as they can cause diarrhea. Mothers often don't seem interested in kibble for the first couple of days after giving birth. However, once she starts eating it, add nutritious puppy kibble to her diet. If she has a large litter, keep puppy kibble and fresh water available at all times during the first few weeks, while other nutritious foods can be offered several times a day. During the first 1 to 2 weeks, the mother usually stays with the puppies almost all the time. This allows them to nurse frequently. The mother may also wake the puppies and encourage them to nurse. Short walks are good for the mother. During this time, the puppies huddle together for warmth and comfort. At first, the mother may need some encouragement to leave her puppies for a short while. She may not even want to leave them to eat or drink. Even when mothers take excellent care of their puppies, emergencies can still happen. A puppy may become trapped behind the mother's back and be unable to nurse for quite some time. Being separated from the litter, even within the whelping box, can be very stressful for a puppy. A puppy can also become trapped under the mother or get stuck underneath or inside the bedding in the whelping box. Sometimes a puppy can hold onto a teat so firmly that the mother accidentally carries it outside the whelping box. Contrary to what is often believed, mother dogs do not normally carry their puppies by the scruff of the neck. They may move a puppy with their nose or mouth when necessary, but they do not carry puppies dangling from their neck. Very young puppies may occasionally be picked up in the mother's mouth, but mothers generally avoid doing this. Even this can carry some risks for the puppy. Traditionally, some breeders have cut or shortened their puppies' tails, or cut their ears into a specific shape. Tail docking is usually performed within the first few days of life, while ear cropping is performed several weeks later. It is sometimes claimed that puppies do not suffer from these procedures because they are so young. But that is not how I see it. In my 30 years of experience, I have seen that puppies are very sensitive. Even the slightest pain can make a puppy cry out loudly, right from the very first day. They also experience stress and distress. Don't do these cutting procedures. These procedures are unnecessary. Today, they are banned or restricted in many countries. Even with good care, you may notice that one of the puppies stops nursing and drifts away from the others, often lying on its side. You try to get the puppy to nurse, but it is not very interested and may even fall off the teat. These are serious warning signs in a newborn puppy and require immediate attention. This condition is commonly referred to as fading puppy syndrome. It is not a single disease and can have many different causes, including infection, hypothermia, low blood sugar, inadequate nutrition, birth complications, or congenital problems. The risk of neonatal death is highest during the first week of life. The signs often become noticeable within the first few days of life. In severe cases, more puppies may start to fade, and canine herpes virus could be the cause. The entire litter may be at risk. Watch my video series on how to help newborn puppies survive. The link is in the description. Good hygiene is also essential for keeping the puppies healthy. Their immune system is still immature, so they rely heavily on the immunity they receive from their mother, especially through colostrum. After giving birth, the mother will often have vaginal discharge for several days or even weeks. It is important to keep both the mother and the whelping box clean. The bedding should be changed frequently, because damp and soiled materials can encourage the growth of microbes. Also, materials that retain moisture can provide a favorable environment for microbes. The puppies also contribute to making the whelping area dirty, but the mother usually does an excellent job of keeping them clean. We keep a small light on at night for the mother and puppies, so the mother can see where she is moving and accidents are less likely to happen. With warmth, good nutrition, cleanliness, and plenty of love, we humans can help give newborn puppies the best possible start in life. In addition to their mother's love, puppies can become accustomed to human presence, gentle human touch, and affection from the very beginning of life. Subscribe to our channel and follow our new puppy care series. 2 episodes are already available. Episode 1: How to take care of newborn puppies, how to help puppies survive from birth, puppy guide, and Episode 2: Retriever puppy, checkup and puppy gender, 1-day-old puppies. New videos will be released weekly. You'll find lots of useful information and practical tips for caring for puppies.